do this before something bad happens.
It's Facebook's fault, I'm pretty sure. I think when you started Facebook, it was challenged.
No, I don't know.
It kicked us off, man.
Shouldn't have anything
Competing.
to do with
It was
that.
competing.
Stupid.
It was competing. YouTube got mad.
Echo, count to 12.
1, 2, 3.
Echo,
4,
stop.
5.
Okay. Taste, you good?
Yeah, I'm good.
Okay.
Hot.
Yeah, you are.
Ooh, yeah.
Very hot.
It's not the kind of hot I'm
Your
not.
wife is
You have
hot,
articles too, right,
Dr. Steve.
Scott?
Yeah.
You have articles. Okay.
Your wife is hot.
She is hot. I'd do her.
For a small fee?
Oh, well. My age. My age.
You'll do anything, won't you?
Yeah, I'd take a Rogersville 3 at this point. All right, ready?
I think so.
All right, let's do it. Well, of course, nothing's working. The fuck? Oh, yeah, good. I'm recording over the intro. That's great. Genius.
Oh, no.
There we go.
Should
Okay,
we try this tomorrow?
No. We're good, I think. I think we're okay, Taste.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who would never listen to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347.
Poohhead.
Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Well, Dr. Scott, how are things at simplyherbals.net these days?
Wonderful.
Yeah, check them out at simplyherbals.net. I tweeted something out about you. I said, I don't say, enough good things about you. I like making, tweaking you from time to time about your East Tennessee pronunciation of some medical terms. But, you're a good friend. You're always here, and simplyherbals.net is your jam. So I should plug it more often. So.
Well, thank you.
People can check it out. I might, might be an interesting thing. You've got that fatigue reprieve shit on there.
Love it.
First off, this is not a commercial, but I am still, despite my BiPAP, and it's better, but today I was using my eyebrows to keep my eyelids open on the way home the last, mile and a half.
Oh, gosh.
And I was going to pull over, which is what I've told everybody that they should do, because my brain is trying to kill me.
Yes.
And why, I don't know, probably because I'm an asshole, but my brain is trying to kill me. And so, the protocol is you pull over and get something to drink and then, walk around for a bit, get back in your car, you should be okay. Or take a brief Thomas Alva Edison power nap. You hold a pen in your hand or your cell phone, and then, when you fall asleep, you drop it, it wakes you up, and then you get on your way. But so I take medicine for this, and it still doesn't work. So I thought maybe I'd try some fatigue reprieve, do a study in N of 1, just to see if I can tell the difference.
Yeah, I think it'd be a good idea. I'll bring you some.
So what I'm asking for is free.
Yeah, I got free
stuff
for you, Dr. Steve. I got free for you.
The new medicine isn't helping you?
No, I can't get the new medicine because my insurance won't pay for it. They put in a prior approval twice, even though they've said we have a physician who has a huge territory, drives all over creation. You know, I drive 2 hours a day sometimes, sometimes longer than that. And the standard stuff, modafinil, isn't cutting it. And now, if I do a modafinil and a sugar-free Monster Energy drink, I'm fine. But that doesn't seem like what I should be doing.
Yeah, I've got something a little bit better. We'll try the.
Oh, okay. Well, you say it's better. We'll see. You may be right.
Maybe the two together would be great.
Yep, maybe so. So anyway, we'll try some fatigue reprieve.
You're bouncing off the wall.
It's very cleverly named. Yeah.
Well, thank you. I hope so.
So anyway, check out Dr. Scott at simplyherbals.net. But it's not a commercial. I'm actually am a little bit desperate at this point.
Yes. I'm here for you.
Wanted to say happy birthday to our network forebear, but the person who created our network, Cardiff Electric. So happy birthday, sir. And I hope you have a wonderful one at the beach this week. So there you go. He's going there for his birthday.
Hey, Sean just got back from the beach.
Sean Pedrick?
Yeah. I need to go to the beach.
He's my date
that's what
to
I
the
heard.
this is my life. I'm doing a weekend away, and my date for this event for the whole weekend is Sean Pedrick, everyone.
The one and only.
Yeah. And Tacey, I think he's probably a snitch. So if he'll be a good chaperone. He'll make sure that I don't do anything stupid.
Okay.
Yeah, we're worried about that.
Like Tacey's. I'll do lots of stupid things, but not that kind of thing you're thinking about.
Right on.
Wear it out.
So anyway, yeah. Sean won the free tickets to the Creep Off Roast. You can go to creepoffroast.com. You might be able to watch it live. I don't think there's any tickets left. It's in Rochester, New York, September 17th. It will be my first and my last roast, where I'm not the roast master. That would be Vincent Paulino, everybody.
Oh, cool.
He's the resident, or the comic in residence at Comedy of the Carlson, where this thing is. Mm-hmm. And there will be some other actual comedians there, and then some other people from the Creep Off podcast. If you don't know what that is, it's in the WATP universe, but they don't goof on podcasts and get in trouble and stuff. They goof on criminals.
Oh, geez.
So it's a true crime podcast, but it's a comedy true crime podcast. Both of them, the hosts are very funny, and each one picks a theme. So when I was on the show, they did creepiest medical professional or creepiest doctor, and so each person tells the story of their creepiest person, whatever the theme
their
is.
encounter.
Yes, and
so
then
this is
their
personal.
story. No.
Oh, okay.
No. It's you find somebody in history.
Okay, gotcha. I'm sorry.
And then you tell the story, and then the audience gets to vote on it. Who brought the creepiest person? And if you lose 5 times, doesn't have to be 5 times in a row. The first person to lose 5 times has to spin the wheel of consequences. And then they have to do whatever it is. So one of the hosts, Carl Hamburger, had to wear a cow bikini on the show on camera for the whole show. Vinny Paulino had to do the polar dash on one. And then that's still in dispute because they were videotaping him, and then the person just forgot to videotape him actually going in the water and coming back out. So now people are saying he never did it, even though you could tell how miserable he was when they finally caught up with him afterward.
Funny.
So it's a funny show. Go to creepoffroast.com, or you could check it out at the creepoff.com if you just want to listen to the podcast. If you're into true crime, it's a fun one. I've been trying to get Tacey to listen to it because I think she would like it. She likes true crime. Did you ever listen to one?
No.
There you go. There you go. Vinny and Carl. There's your endorsement from Tacey. Now. All right. So there you go. Scott, you have some topics for us today?
Yeah, I've got one
Yep.
you sent me
Yep.
about the gorilla.
Yeah. Let's talk about this. This is crazy.
Yeah, so Dr. Steve found this article and sent it to me the other day. It's the invisible gorilla strikes again. Sustained, and here's the topic: sustained inattentional blindness.
Right.
And expert observers.
Yes.
So real quick, here's the abstract. We like to think that we would notice the occurrence of an unexpected yet salient event in our world. However, we know that people often miss such events if they are engaged.
Humans are the worst witnesses.
If they're engaged in a different task. The phenomenon is known as inattentional blindness. So you're just not paying attention. So what they did was they took there's been multiple studies, but this one,
we're talking about this one. This is crazy.
This one is, we asked 24 radiologists to perform a familiar lung nodule detection task. A gorilla, literally a gorilla, I was shocked when I looked at it.
Yeah.
A gorilla 48 times larger than the average nodule was inserted into the last case. 83.
Oh, wait, so it wasn't a gorilla's lung. They
No.
actually took a gorilla?
A picture. Dude, that's the craziest thing I've ever seen. No, honestly. But check this out. 83% of the radiologists did not see the gorilla.
Well, they said it was a nodule. They said there's a large nodule.
No. Check this out. 83% of them did not see it. But what they did, it was kind of a cool study because what they actually did, though, they monitored, they used the tracking, and they could actually see the eye movement of the
Yes,
radiologist.
yes.
And they not only did they just missed the piss out of it. They even looked directly at the gorilla
And still didn't see it.
didn't register. So even expert searchers operating in their domain of expertise are vulnerable to inattentional blindness. Isn't
Yeah.
that crazy?
Yeah.
So Dr. Steve, they showed, and look at this, Tace. They literally have superimposed an image of a gorilla waving.
Oh, yeah. There's this thing called the invisible gorilla test. That's why they use gorillas for this.
It's crazy.
There's one called the invisible gorilla test from 1999. And what they did was they watch a people video, and you can see this on YouTube. Just Google it, or go on YouTube and search for it. They watched a video of people dressed in black and white passing basketballs. Participants were asked to count the number of times the team in white passed the ball, so they gave them a task.
Right.
During the video, a person dressed in a gorilla costume walks amongst the two teams, and then the participants were asked whether they had seen anything unusual in the video. Nearly half the participants provided negative responses. In other words, they never saw the gorilla.
Right.
That's so crazy.
It is insane.
And I've got a link. If you remind me, I will put this on our YouTube page at youtube.com/weirdmedicine. It's so nuts.
Hey, and can I tell you something about this? So I really felt this was so compelling. So when I was reading this, and I just did what I did to Taste, I scrolled down and I looked at these images, and I looked all over this thing. For the first image, I said, "Well, heck, there's no gorilla in that." And scrolled down to the second one, I didn't see anything. But sure enough, do you see the gorilla in there on that image?
So Tacey's looking at it.
Poodle.
No. So, hey,
Tacey sees a poodle.
so here's the crazy thing. Now that I've looked at it for the fourth time, I actually can find the gorilla. But I think what those radiologists they're so trained to look at very specific things, kind of like with those balls.
Yeah,
Pass, you just miss it.
Yeah,
And
yeah.
I literally just now saw it when I was
Even though
showing her.
you knew,
Even though
you
I
were
was there.
trying to make fun of them.
Yeah, I
and
knew
you
it was
still didn't
there.
see it.
Yeah, it's crazy. But now it's crystal clear. It's right there,
Yeah.
upper right corner.
Well, nobody can see it because this is a radio show.
Oh yeah,
but
well you'll have to trust me, guys.
yeah. Google this stuff. It's pretty crazy.
Mm-hmm.
And I have heard of other. And they for some reason they always use somebody dressed up in a gorilla suit.
Mm-hmm.
where they'll
Because it's like
they'll
you
do
think,
forensics.
Yeah, there's no way you could not see a gorilla.
They'll say, right,
Yeah,
that's
yeah,
right.
that's what
Because
I
it's so weird
There's just no
that they'll do these forensic tests to demonstrate that people are terrible witnesses. And they'll have a crime going on. And they'll say, now watch, try to get all the details of the criminal and all this stuff. And then they'll have a gorilla walk through and nobody will notice the stupid gorilla.
Pay attention to their hat color or whatever.
They should put real gorillas in there. I bet people would notice that.
Isn't that funny? Yeah, but I'll tell you, Dr. Steve, and when I was reading this, it brought me back to my days playing baseball and how when you're so focused on an image, like specifically when you're trying to hit a baseball, which is the hardest thing to do in athletics.
Yeah,
The more you can block out everything else, the better hitter you are.
Yes.
And the hypothesis, the hypothesis is that because Ted Williams is the greatest baseball hitter in history, the only person ever to hit over 400. They said it's because he trained the occipital part of his brain, the visual cortex, to focus because he was a fighter pilot, and they used to line up planes and fly like 20 of them in a row and fly by each other, and they'd have to identify each marking on each plane.
Yeah.
And they think that's why he was such a great baseball hitter.
Is that right?
Yeah, that's what the.
Isn't that interesting?
Yeah, so that's
Well, you absolutely,
because you're just
if you've
bullseye.
ever played even at a semi-elite level, you understand that whole Zen thing where you're not thinking and your brain is hyper-focused on what you're doing, but without any effort.
Yep.
And that's the key.
Yep.
And that's what our son will be training people to do, Tace, because he's getting his PhD in sports psychology. So there you go.
Hopefully.
If anyone is interested in looking at that selective attention test, whenever you happen to be listening to this, go to my Twitter at Weird Medicine, and I'll tell you what, I'll pin it to the top. I'm going to pin it to my profile, and then you'll be able to see it at the very top. So just look at my profile. I just stuck it up there now. All right, cool. Anything else on that?
No, that's it on that one.
All right, you got anything else?
Yeah, I actually did find another interesting one. This is from the Holistic Nursing Practice magazine. And they do a lot of good solid research.
Do they?
They do good solid
Okay,
research.
I'm not saying that
You're
like
not-
Jim Norton. I'm not saying do they. I'm
Uh-huh.
saying do they really.
Oh
Yeah.
shit! I hit the wrong button. Son of a bitch! No, here. I'm sorry. Here we go. Should
Because you're an idiot.
that is the truth. All right. So, should acupuncture-related therapies be considered in pre-diabetes control? Research from, and you're going to love this, a systematic review and meta-analysis
That's
of randomized controlled trials, Dr. Steve.
that's better
Cha-ching.
than shit.
Yeah.
It is.
No,
It's
I know
better
it.
than shit.
No, is it perfect? No, but it's...
And then you got to determine that the studies that they did were good studies before you mush all the data together. So for people who are listening that have not listened for a long time, don't know what we're talking about, this is where you take a bunch of smaller studies and mush all the data together to get a bigger study so you can see if you can get statistical significance out of the data and make some conclusions. But anyway, go ahead.
So anyway, they were assessing the effects of and safety of acupuncture-related therapies on glycemic control for prediabetes.
So blood sugar control.
Yes. Sir.
Okay, so
Yep.
tell me how they constructed these studies.
855 identified trials, 34 articles, qualitative synthesis, 31 were included in the final meta-analysis. So what they did is
So what they did was they had 850 articles.
Yeah.
Out of that, only 30 had data that they felt was worth mushing together.
right, yeah, the criteria, met their criteria.
That's a pretty sad, ratio. But anyway, okay, so they found 30 studies.
Yeah, but at least that's 30 more than is more than more than one.
It's more than 29. That's right.
it's better.
Dr. Scott's good at ciphering
I'm good
there.
at ciphering. I'm pretty good at them gazentas.
Yep.
Them gazentas.
3 goes into 9 three times.
I think it's 3 times. So anyway, compared with usual
2
care,
goes into 4 twice.
twice. Compared with usual care, sham intervention
Okay.
or conventional medicine.
There you go. Okay.
The acupuncture was found to be significantly better by lowering fasting plasma glucose,
Okay.
the 2-hour
It's
plasma
because they make
glucose
you lay there for 2 hours. They can't eat.
and glycated hemoglobin. So yes, you're right. We starve people to death while we're treating
Yes,
them.
I've done it. I know what it's like.
We're skewing the outcomes.
Yeah, no, but okay. So what acupuncture did they do? Did it matter what part of their their quadrants or whatever you call those meridian points or whatever that they did, or can you just stick the needles anywhere? End of your dick, tip of your nose, what?
Pretty much
Under your fingernails?
But if you have one going on the end of your dick, you probably should
Well, I'm
find
just saying.
somewhere else to go. Yeah, but no, there was not a specific protocol listed in this.
So just stick them anywhere.
Well, what they're saying is because it can help with overall health and well-being. It helps to lower your stress levels.
Yeah, that I
Hey.
can understand. The cortisone.
Yep.
Okay.
Cortisol levels and
The process.
yeah. But so in other words, all they said was that having the acupuncture treatments for whatever, and Dr. Steve, you know as well as I do, if it's for pain,
Yep.
we do really well with a lot of types of pain.
Yep.
Lots of.
I'm
stress.
just trying to figure out what the mechanism would be.
Yeah, it's got to be lowering serum cortisol, increasing serotonin. All
That's
those-
interesting.
Yeah.
It has to be. This would be my guess on the mechanism for this.
Mm-hmm.
Is that when you go to an acupuncturist, it's one of the most relaxing places. It's to me, it's
Oh, yeah.
less. It's more relaxing than a spa because
yeah.
at a spa, you got like hot men and women, looking at your, looking at you and
junk.
stuff, and looking at your jungle region and making internal, evaluations and stuff, and it's to me that's stressful. And I don't want people messing with me. When you're at the acupuncturist, well, Tacey, you talk about it. You gave me a thumbs up on that. Talk about what it's like going to the acupuncture office.
It's nice.
Okay.
I mean, I was very surprised. I didn't know what to expect, though.
Right. So what did they do to you? And when I said it's very relaxing, you went, mm-hmm. So
Put me in
what's that about?
A cool,
Yeah.
darkish room.
Yes.
Stuck me with some needles and with a TENS unit.
Denzu, yep, on her,
And
yeah.
left me alone for how long, Scott?
About 20 minutes, yeah.
And when they came back in, I didn't want to leave.
Yeah. It is intensely relaxing, and that will reduce stress hormones. Epinephrine, cortisol, that kind of stuff would reduce blood sugar. So what I would like to see is maybe there are studies on this, on acupuncture, the whole thing, not just coming into a laboratory and they're sticking needles in you, but they're doing the whole process.
Yeah.
If you can show a decrease in, say, circulating epinephrine, circulating cortisol and stuff, because that's good.
Mm-hmm.
Then the question is, do the needles have anything to do with anything at that point?
Sure.
Is it, could you do the same thing without it or with some other thing? And there are other interventions that might do better, or needles with different electrical frequencies. I mean, there's all kinds of cool things that you could look at.
Yeah. Well, one of the things that I use the TENS unit for is because they've shown that by using electricity on the needles, it stimulates the mu-opioid receptor stimulating hormones in the brain.
Right. I can see that.
And it increases serotonin in your
Okay,
spinal cord.
So stop with the jargon. Explain what that means. When you said it stimulates the mu-opioid receptors in the brain, people are just like, ooh,
Yeah. So just
emotional damage.
Yes.
Well, I mean, what does that mean?
Yeah, well, by putting a needle,
I know
by
what it
sticking, but just by sticking a needle in through the skin, it stimulates a response. So if you just do plain needles, because we get this question all the time about the difference between dry needling and using electric acupuncture. One of the reasons the dry needling does work is because it stimulates the peripheral nervous system.
Okay,
So-
what does that mean?
well,
Peripheral.
it's anything outside
He
of the
uses
spinal
all
cord.
kinds of fancy words at
Anything outside the spinal cord and brain. So the nerves outside the spinal cord and brain. And it works very similar to the way an Advil or a Tylenol or an aspirin is for helping with that pain. Okay. When you
by a completely different mechanism.
completely different mechanism, right? Okay. And then by using electrical stimulation to it, it stimulates the brain to release more of an opiate through your system.
Yeah.
Which is, so we're actually working on treating pain from a couple different
So
approaches.
there are endogenous opioids.
Endogenous.
Those that means made from the inside your body. The reason that when you take heroin that it does something is because it attaches to receptors that are there, that were already there for internal drugs that look like heroin. You have the same molecular structure, and they operate the same way. That's when people get addicted to running, like my friend John, who is now at, is he in the chat room today?
Yeah.
He is?
He was earlier, yeah.
Logan Field is?
Yeah,
He hasn't missed running one day, and I think he's like at 1,000 days or something like that. May even be longer than that if he's still in there. See if he chimes in on that. But he won't miss a day.
Yeah.
And like if he does surgery, I said, what happens if you have to go in for surgery? He said, well, I have to start all over again. But if it's raining, snowing, he is out there. And I postulate that he may be addicted to the endorphins, in other words, endogenous opioids, molecules that are made inside the body that stimulate the same receptors that Lortab and Percocet and heroin do.
Roxy's, Oxys.
Yep.
Yeah, all the
Need my
good
hydros.
All the good ones.
Give me some hydros
Yep.
and some oxys and some Dilaudid.
I like to pull up my one of our dear friends is a pharmacist, and
Yeah.
sometimes I'll pull up, and if one of the girls there doesn't know who I am, I'll say,
do.
"Oh, hey man, can I get some Lortab?"
I do the same thing. There's a pharmacist in town. I was there when he was born,
Oh my gosh.
and his mom his dad was my best friend in residency, and I'll always call him and go, "No, Colton, I need me some of them Lortab 15s." Of course, they don't make such a thing, and he'll just go, "Come on," because he knows it's me. It's so stupid.
Oh, I love it.
Well, there for people who think that acupuncture is just complete horseshit, part of the problem is that some of your fellow practitioners have not been helpful
Not
to
done
you in
Steve
that
Barrett. No,
regard.
you're correct. You are correct.
But the type of things that Dr. Scott does, there's really good data behind it, and it is drug-free. You're generating the drugs inside your system, and anybody that wants to, argue with us about that, I'll defend Scott on the things that he does because he does the things that he knows have data behind them.
Right.
And you can go to PubMed and you can find tons and tons of articles that show that there is, a positive net effect with acupuncture when used under the correct
And used in the
circumstances.
right things, right?
And this article here from Medical News Today says, its conclusion is, shit. Let me get to that. Because whoa, you
Hey.
son of a
Come
bitch.
on.
Come on.
Good God.
God, man.
Anyway, well, now I can't find it because that scared me so much that I hit my
What
mouse.
was that?
I don't know. Honestly, I don't
It's
know.
the spooky show, y'all.
It was a spooky show.
That acupuncture is safe and effective when done by somebody, basically, to paraphrase them, who knows what the fuck they're doing.
Right.
So you go to someone that's taken a weekend course, they can kiss my ass for the most part.
Yeah, me too.
Dr. Scott spent 4 years of his life in traditional Chinese medical school, and I respect that. Anybody that gives up that much time and effort studying all this stuff, deserves your respect. Now, for the effort put in, and there's a big difference between people that come out of your office, because my cancer patients go to you.
Oh, yeah.
100% of them feel better when they come out of there.
Yep.
Whatever it is, who cares what the
Doesn't
mechanism
matter.
is?
Yep. As long as it works.
So anyway, all right, enough with and now I'm starting to sound like a kook. All right, you got anything else?
No, that's it.
Promoting your own shit.
No, I was like Kirby
the
saying,
Scott
would y'all
show.
take a question?
Yeah, go ahead.
I think he said, would we take a question? But
Yes, of course.
No, he's telling us to take some.
Oh, okay. Oh, okay. Okay, fair enough.
So-
Fair enough.
Do you
Number
wanna do
one
that?
thing, don't take advice from some asshole on the radio.
All right. Let's.
Okay.
This is Lee
Hey,
in
Lee.
North Alabama, and I've got a question regarding some HRT that I'm doing.
Okay, HRT being hormone replacement therapy, presumably testosterone, but not necessarily. We'll see.
When I did my last blood sample, I was at a 200, and so.
Okay, so listen, when we give out these raw numbers like this, we're not using the units. I don't know if he's talking about nanograms per deciliter or what the units are, but I'm assuming that's low, and if it's low in his lab, then the low normal in most labs is right around 350, if I'm not giving out the units, and normal is anywhere considered to be 350 to 850, somewhere in there. Depends on the lab, so you got to look at the normal range. But just remember that if you're in the low normal range, you're probably actually low.
And if you feel bad and you're in
Yes.
the low normal, that is
There you go, Tace. You're going to get one of those.
Give yourself a bill.
That is exactly right, because symptomatic people in the low normal range have been shown in studies to derive benefit from treatment from hormone replacement therapy, even though, quote unquote, technically they're in the they're technically, quote unquote, low normal or normal, and they're not. It's because there's so many people are low that when they determine what's normal, they're including a bunch of people that are low because they've never been diagnosed in that average. And so it skews the normal range low. So all of the urologists that I've talked to say if you're low normal and you have the symptoms of low testosterone, that you should be treated. Okay, anyway, let him complete.
Through some doctor guidance and stuff, we've started the therapy. I'm doing injections.
Okay.
Every 10 days.
Okay.
And so
there's lots of things you can do. He's he's giving himself shots. Some people do the gel. Some people do pellets. There's all kinds of things you can do. So
injecting in my left leg because I'm right-handed. I can control it better. And I inserted the needle into my leg. This was a week ago.
Oh, no.
And when the needle went in, that area and that muscle where the needle penetrated my leg cramped, and the needle actually racked in one direction and then stood back up. And I pulled the needle out, and I managed to get the injection in.
Yeah.
But I'm curious, why in the world would it have done that? Did I hit something?
Yes.
Or
you stuck a needle in your leg. Well, that's what you did.
What? I just don't want that to happen again because it hurt like some bitch.
Yeah. Go ahead, Scott.
I would say it sounds like the motor point in the muscle.
Yeah.
So it's kind of where the nerve innervates or enters the muscle, and it's the biggest bulk of it. And if you'll hit that thing just right, it will cause a lot of times a spasm.
Yep.
You know, and my suggestion would be next time you do it, poke around and find a spot that's not.
You mean with your finger?
With your finger, yeah.
Not with the needle.
Yeah, not with the needle. Yeah, with your finger, kind of poke around and palpate, mush until you can find a not real sensitive spot. And that's probably a better place to go in.
Yeah.
And I would, one other thing I would say too is he might be able to do it if he's right-handed, do it in his right hip.
Yes.
And buttocks is where I would do it.
Well, I don't know if I
your
go
leg.
with the hip. I don't know. That's a tough one because you got to go to the right particular quadrant in that gluteus area. And I do think the thigh is easy to get to, but if you're right-handed, you can do your right thigh. Dude, that makes me wonder where he's injecting it.
Yeah, no.
So this is the correct way to do this. You should use the vastus lateralis muscle of the thigh. So let me tell you where that is. You divide the thigh into 3 equal parts vertically, not horizontally. So going from hip to knee, you draw a line from the hip to the knee, divide it into 3 equal parts, and you're going to go to the upper top part of the middle to lateral section. Okay, and then if you do that, there's no nerves and stuff over there, and that really, for me, that would be easier for me to hit from the right than from the left. Let me try it from the. Yeah, no, it's easy either way.
Yeah,
it's either way.
Well, there's cutaneous sensory nerves, but no.
Well,
big
of course,
nerves.
No. But I'm talking about there's the femoral arteries and stuff go on
that's
the
inside
part.
Of your leg. Right.
That's right. Yeah. That's right. Yeah, very good, Scott. You know your anatomy.
Yeah, buddy.
Give yourself a bill.
So, dude, if you want to email me, I'll send you a picture of where you need to be going. But Scott's right. Even then, like you can poke around, and if I poke just right, I can make that muscle spasm.
Yep. Yeah.
It jerks. It's really a reflex jerk, is what it is.
And it's called a trigger point or a motor point if you want to kind of do a little research on that. But that's believe it or not.
Well, I just looked on the camera. It looks like I'm masturbating.
Oh, funny.
Because I was
Nice.
I was poking my leg. And if I do that, it looks like. Can you see that?
that would be.
I'm sorry for the people who are listening.
And that would have been a whole lot more motion than you probably need. But
Yeah,
you know,
yeah. No, not for me. No,
Anyway, but the
I was in the bathroom at WRAL TV a million years ago when I worked there. There was the weather guy was a guy named Bob DeBartlehaven, and the news guy was a guy named Charlie Gaddy, right? And so they're both in there pissing at the same time. And the one guy, and this isn't a great joke, but it's just something that I remember. And Charlie Gaddy said, "Oh, you know, he bragging about how what a giant cock he had, right?" And he said, "Well, they need to lower this urinal for me." You know, and Bob Bartlehaven, without even missing a beat, said, "Well, they need to raise it for me 6 inches off the floor."
You get nothing.
Oops, wrong thing, but it worked anyway.
Doing
Anyway.
great with sound effects.
I
today.
know, sorry, I was going for that.
oh, good.
All right, yep, those were the good old days. Old Charlie Gaddy and Bob DeBartlehaven, and doing championship wrestling on weekends.
Yep.
Ric Flair recently did, quote unquote, his last match.
Yeah.
And our buddy Shuli Egar was on the roast of Ric Flair.
Oh my goodness.
And our friend Vinny Paulina was there to document everything.
How did the match go?
I don't know.
Okay.
He didn't die. All I know is he didn't die. I also hear that he was a complete you-know-what.
Oh, really?
Now, I worked with Mr. Flair for 3 years. Never spoke a word to me, not once. Now, I was a peon. I was just the audio engineer and sometimes cameraman. But, never. I don't think any of those guys would remember me. But I've got some great stories about working with them. That was,
cool.
Wahoo McDaniel, Baron von Raschke. I've told the story about Igor the Polish Prince and his Polish sausage. Have you ever heard that? I've told you that story, Tice?
I don't think I've heard the Polish sausage.
Do you know this one?
story.
Yeah, I think so. Yeah.
This guy, his name was Igor the Polish Prince, and he had that sort of generic Eastern European, "Oh, I am Igor, Polish Prince," like that, right?
Yep.
And he was from Kernersville, North Carolina, I think. I think that's where he was from. And he would get on, we would do these commercials, right? And there were we did 70 commercials on every Wednesday, 2 for each of 35 different markets.
Okay.
And they had the announcer, "Tonight in Dorton Arena," or "Tonight in Charlotte Coliseum." And then Blackjack Mulligan would get up there and he'd go, "Wahoo McDaniel, if you're listening." Of course, he's listening. He's sitting right there because they're all on tables on either side of this thing because we had to get these things whipped out. Well, anyway, Mighty Igor would get up there and he would be gnawing on this Polish sausage. He'd never take a bite off of it and chew it and swallow it. He'd just gnaw on it, right?
Gross.
And it was just kind of gumming it.
Ugh.
And so that was every Wednesday. Well, I when I would come and do the morning show, which was at 6 in the morning, so I lived in Efland, North Carolina. It was an hour away, so I'd have to get up at 4 to get there by 5 so that I could set up for the show at 6. And one day I was cleaning up the living room set where they all sat and did this sort of chatty show, farm show in the morning. And I'm cleaning the sofa, and I lift up the cushions to clean under the cushions, and there, lo and behold, was Mighty Igor's Polish sausage underneath one of the cushions. And what this guy was doing was when we would be done, he would shove that thing under the cushion, and then when he'd come back the next week, he'd grab it and stick it back in his mouth and gnaw on it. Now I understood why. No, yes, of course. What else? Why other reason would it be there? There's trash cans everywhere. He could have just thrown it in the trash. He was saving it for next time.
Oh my, that's awful.
So it was so great. have a million of those stories with those guys. But anyway, maybe we'll do a wrestling show sometime. All right. So insane muscle spasm. We done with that one?
Yep.
Okay. Let's do. Oh, here's a good one, and Dr. Scott can talk about this.
This is Wade from Louisiana.
Hey, Wade.
Was laying in the bed, sleeping, had some kind of upper respiratory thing. I was coughing and tossing and turning, and I woke up about 2:30 in the morning with a serious case of vertigo.
Okay.
Went to the ER. They really didn't do anything but give me something for motion sickness. And I come home.
This pisses me
I
off.
actually did the Epley maneuver.
What? Okay. Why does this guy have to know and do the Epley maneuver?
Yeah.
You know what I'm saying?
Yep.
We're going to talk maybe next week. We might get Gina Levy on here about how she was treated when she had her mastectomies for pain. It was unbelievable. You know, excruciating pain. I don't know if they gave her anything. We're going to talk to her. Because she's been complaining about it online. I said, I pulled a trick like one of our friends online. Hey, Gina, come do my show. Certain people will know the joke behind that, but I did that, and so I think rather than have her call in the voicemail, we'll just have her on. That's Bob Levy's wife, and we love Bob. Bob's a friend of the show. So anyway, but yeah, this kind of stuff is starting to piss me off more and more.
And it cleared up shortly after that.
And have you seen the video? We got to do this one on this show too. The video of the woman that went to the ER and had monkeypox, and they said they'd never heard of it. Yeah. And
my goodness.
Yeah, and then she went to her primary. She said, I think I have monkeypox. They're like, we don't know what you're talking about.
Oh, for God's sakes.
It's like, do you not watch anything on the news? Do you not read
I told you.
I know, honey, I'm telling you. Every state sends out the monkeypox and COVID advisories. Nobody reads anything.
I think we're at 50 today in the state of Tennessee.
Ooh.
I think.
Okay, that's some emergency. But anyway, we'll talk about that in a minute. When the WHO declares an emergency, all they mean is that countries who are friendly with the WHO should now start reporting cases to them. That's all that means.
So go back to this guy.
Yeah, okay, sorry.
And this maneuver.
So he goes to, and we'll talk about what the maneuver is. So let me back up a little bit. So he goes to the emergency room.
They really didn't do anything but give me something for motion sickness. And I come home and
that what they probably gave him was meclizine.
Meclizine, yep.
Yeah.
I actually did the Epley maneuver, and it cleared up shortly after that.
Well, there you go.
Which was hours and hours
Give
later.
yourself a bill.
I was wondering if the coughing and the tossing and turning combined is what caused the little crystals to break loose.
See, this guy knows everything.
Float around.
Okay, we're gonna have to back up and tell everybody this guy's a damn genius. So,
Yeah, he's figured it out.
So
I guess his question is though, and he is correct, I think, in his assumption.
Yeah, he's wondering if the cough. Okay, so talk about benign positional vertigo for a second.
BPPV.
There you go.
It's an inner ear problem. It's the inside your ears. You have these things called the semicircular canals.
Right, they're the inner ear.
Yeah, inner ear, and they're three little kind of tubules that have fluid inside them with little hair-like follicles. And when you move,
and they're oriented in 3 dimensions, which is fucking genius. The way that this thing is, because they detect acceleration. So way before Newton invented calculus, and Zeno talked about absolute motion and stuff like that, the semicircular canals were already analyzing in an analog computer type way acceleration in 3 dimensions. So go ahead.
Yeah, and what happens is
I will give whoever designed these things one of them.
But
it's brilliant.
Yeah, but the cool thing is that they have fluid inside them, but they're not completely full. So when you move, the fluid moves around, and the little hair follicles can detect the motion and sends a message to your brain, say, "Hey, we're moving right or left or forward, up or down, whatever."
And the fluid moves,
right,
and it has momentum too. So when you spin on a bar stool and then stop, the fluid continues to spin, and that's what makes you dizzy. But anyway, go ahead.
Yeah, it's actually pretty incredible. But there are some little calcium crystals inside those, and they can become dislodged.
Yep.
And when they do, and typically it's from a head injury. You can get conked in the head or some violent kind of motion.
It's going to happen when you got terrible, racking and cough.
Yeah, coughing and shaking your head back and forth. And he probably just dislodged those crystals and subsequently gave himself the BPPV.
Yeah.
Yeah.
And so you do the Epley maneuver, right?
Do it. Yeah, we do it some. And it's a, gosh, I would hate to try and do it, by myself when I was having vertigo, and just be sent home from the emergency department and say, hey,
you can do it, though.
You can.
I have people with benign positional vertigo that I teach them to do it at home.
Well, especially after the first time.
Yeah.
But you would hope somebody would help them do that, while they're in the certain...
Well, he called us. I wonder if he heard about it here or if he's just, already knew about it. But do you want to walk people through the Epley maneuver, or do you want me to?
Well, I've got it right here. I was just going to read the steps. I was going to...
You could have pretended you just knew it off the top of your head.
I know it, but I don't want to screw it up. But you do. You've been sitting on a bed. Mm-hmm. Turn your head to 45 degrees to the right.
Yep.
You lay back quickly, keeping your head turned. Now, when you lay back, your head should be a little extended back over a pillow.
Yep.
And then what you're going to do is you're going to flip your head after 30 seconds.
Wait 30 seconds.
Yeah, 30 seconds or so. Then you flip your head to the other side, the left side, and do the same thing. Wait for like 45 seconds. Turn it back. And what you're trying to do is dislodge those crystals or put them back in place.
Yeah. And that's it. Okay, so if it's your right ear. If it's the left ear, you do the opposite.
Right.
And you guys aren't going to remember this, and I'm not even sure that us describing it is sufficient for you to do it. But just know that it's there. Mm-hmm. And if you have positional vertigo, you can try this at home. You really can't hurt yourself. You just don't want to. You don't want to pull a Bob Saget, and no. I'm serious. No disrespect.
No.
Because I loved Bob.
Oh, gosh.
And when you lay back, make sure your head is going to hit your pillow and not the back of your bed. Mm-hmm. Some of these hotel beds, I've seen this before, where the hotel beds have kind of like a sharp wooden, like a beam or something on the back where the pillow goes, and it's really easy. If you lay back too fast, you don't realize how much force that is because you're used to doing it on a pillow if there's something hard and sharp there.
Yep.
Horrible. I mean, I love Bob, so I'm just saying, if you're going to do this, be safe doing it because we don't want what happened to you to happen to Bob Saget, even though Scott apparently thought that was hilarious because he was laughing.
No, I wasn't laughing at him.
I know, you were just saying how ridiculous but what I was saying was. But but just Google Epley maneuver, and if you really want to do it right, just look at it on YouTube, and they'll show you how to do it, and you can do it at home. But just be safe. When you do that first laying back fast, you got to make sure that pillow's in the right place and that there's nothing hard back there.
Yeah, and you don't want to extend your head back off the bed,
right,
and wreck your neck that way too.
Right.
Yeah, so it's you have to pay attention.
Okay, all right. So I think that's what happened. Now, if you've been coughing, and you get vertigo that will not respond to the Epley maneuver, you may have another thing altogether, and that is called semicircular canal dehiscence syndrome. And semicircular canal dehiscence syndrome is a real problem that can only be treated with surgery. And dehiscence just means when something comes apart. And so you can have, the coughing, the pressure can actually cause the semicircular canals to be damaged. And that's a whole different thing. This guy got better with the Epley, so I don't think he had that, but I'm just throwing that out there. This is a rare syndrome. But if you ever get COVID and you cough for 6 weeks like I did, and you start seeing stars when you cough, that's how bad it is. Sometimes things can happen, and that's one of them.
Yeah, and as Amanda so poignantly says, and make sure they don't have a neck injury, especially like a
Yes.
a multi-level spinal fusion. You don't want to be doing
Yes,
that.
of course. Yes, thank you. Thank you.
So that is correct, Amanda.
Yeah. And a matter of fact, don't do any of this shit without talking it over with
All
your
right.
doctor first.
We're just a bunch of old clowns.
Yeah, we sure
Bunch of
we are. We
hillbillies.
don't know nothing about
Ain't no-
nothing.
Don't know much about nothing.
All right. You'd be crazy to do what we tell you to do. All right. Let's see what this
Hey, Dr. Steve, this is an old friend of yours calling. I won't say my name. I know you know who I am by now. And I just want you to know it's just a hello call. It doesn't mean a thing. I don't need any money, and I'm not in trouble, and I have no medical problems. So I'm not calling about free advice or cash or anything like that. It's basically a love call, Dr. Steve. It's an old pal of yours. I won't say my name because I don't want to make any trouble or anything. But you know who I am. And we go back. And it was a hell of a trip. What a wild, crazy trip it was there in the old chapel of UNC North Carolina RTVMP department, where we had so many laughs and so many wonderful experiences with professors that we were lucky to be around. I'll tell you what, more better than we deserved, as they say, Dr. Steve. Dr. Steve, I'm not going to hold you on the line very long because I know you got a lot of messages.
Yes, he is.
Okay. This call is 4 minutes long.
God.
The basket is filled, not taking any messages. I know you won't let that go on like that for very long because that's just downright rude. You got the technology, you have the phone, and you haven't bothered to go in and Dr. Steve, that's not like you. I hope it's not an indicator that maybe your life's kind of, gone awry, as they say. Hope you're hanging on to the home fireplace, the home mantle there, and I know you are. And the ship.
We'll play part 2 next time.
Yeah,
Good Lord, Dave.
We're running late.
That's my old buddy Dave Haynes doing another one of his characters. He used to call in. Do you remember, Tacey, you might remember this, when some of our callers got through to Big Kev? Big Kev's Geek Stuff used to be, we used to share Saturday Night Virus with them.
Okay.
And some of our callers got through to him by accident, and so he played them and goofed on them, right? And then my buddy Dave started calling him, well, that old Big Ken or Big Keg or something. I can't remember what he called him. And he would goof on him, so I didn't have to. And he would pretend like he was somebody calling Big Kev's Geek Stuff. And that's the same guy. So anyway, he's a damn nut. All right. Absolutely my best friend from the 1970s. Let's see here. You want to do one on neutralizing antibodies? We could do that. Let's do this one.
Hey, Dr. Steve. I'm having a question about the COVID antibodies.
Okay.
So I currently have an autoimmune disease, and I have received the Moderna vaccines 1 through 3. My rheumatologist in Cleveland decided for me not to get the 4th booster until we checked my antibody levels.
Okay.
Because I had such a rough time with the 3rd Moderna. High fever, chills, body aches, just really severe reaction, and it increased my inflammatory markers.
I wonder if the reason she had such a rough time was because maybe somewhere in there she'd actually gotten COVID, but let's see.
So I had my last antibody screen showed that my numbers were at 50,000. 8 weeks later, they're at 25,000. What is the magic number of?
Okay, we're running out of time, unfortunately, so I'll give you the quick answer. It depends on the units. Again, the normal units in international units per milliliter, the neutralizing antibodies are like 448. So I'm assuming they are using different units when they're saying that her antibody level is 50,000.
Yeah.
So if it were 50,000 international units per milliliter, I would say, well, yeah, you're in great shape. But if you will email me and send me the actual lab work, I'll look at it and I can calibrate it with, I can convert it to these units and see where you are. But as it is now, this is that same problem, with different labs reporting things with different units. I don't know what units they were using. Okay. Well, listen, thanks, everybody. Thanks, Scott. Thanks, Tacey. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye, everybody.
Bye. All right. Well, that went by fast. Why are you whispering?
We'll do that maybe on the podcast.
What? Yep.
I'm good. good for now. I pushed my dinner back.
You sure?
Yeah, no, really, because I want to make sure we got to play at least one tune.
Yeah,
there was
okay.
a question. There was a question, real quick. If
Well, do you want to do it on the show?
that's what I was going to ask.
Oh,
you,
well,
if
let's
that's
do it
okay.
right now.
Yeah,
Yeah, okay.
because Tacy, Cindy Walker had a question.
Okay.
Yep. So
Let's do it right now.
Yep.
Okay. All right, Dr. Scott, you got any other questions for us?
Yes,
from the waiting room.
From the waiting room, yes. So Cindy Walker asked if Tacy's vaginal treatment was still effective. And if it's been, because it's been a month or so since we've spoken about it, maybe 2 months or something. So,
Yes, it is.
Update.
It is still effective. But
Okay, so there are people who don't know what we're talking about, so just give them the Reader's Digest
I'm
version.
not exactly sure the one that I had done.
Well,
so
okay, you had radio frequency and microneedling.
Radio frequency and microneedling, but I'm not exactly
That's all.
sure
That's
the name
fine.
of them. Okay.
It's called Votiva, but it doesn't. That
Okay,
that part
well,
doesn't
thank
matter.
you.
Yeah.
So, anyway, yeah, I would still do it again. I'm not going to the bathroom as often. I'm not getting up in the middle of the night as often.
And when you laugh at my jokes, do you still piss your pants?
No, because I'm not laughing.
Oh, yeah.
But yeah, I would absolutely do it again.
nothing.
But I don't know how it compares to like true surgery.
Well, you wouldn't, but they're not asking that though. So
So-
you had some stress incontinence. Is that
Yes.
fair to say?
Yes.
And can you tell any difference in that?
Yes, I can.
Okay. So and how many treatments did you have?
3.
You had 3,
Mhm.
each lasting for how long? Each time?
Well, you go in and you do the numbing for like 30 or 40 minutes.
How do you do the numbing?
Well, they use this. They stick like this this bullet thing in you, and it does like Kegels with numbing cream all over
Okay.
it, so it numbs everything that way.
So it stimulates you electrically to contract the pelvic muscles?
Yes,
Really?
yes,
Okay.
that's how they numb you,
Okay.
and then they get in there with that wand and they do the work.
Yeah. Is it painful when you have it done?
Yes, if it's not numb where
Yeah.
they do it, then absolutely it's painful.
Okay, so how much of you wasn't numb after the Kegel
Well,
machine?
the last time I had it done, I was not as numb on the outer area as I was
I can't
on
imagine the outer area.
And yeah, so they didn't
But on a
go
sca-
as hardcore on me, but yeah, it would have seriously
you would have jumped
hurt.
off the table.
Yeah, yeah.
On a scale of 1 to 10, where the numbing was when you were having this done, where would you rate your pain? With 10 being, they're chopping off your leg with a rusty
Like
saw.
a 1 or a 2. It was
Really?
nothing.
Okay.
Nothing. It was not even that.
So it's very tolerable.
Yeah, it was just more embarrassing than anything.
Yeah, sure.
It's like going to the dentist when they have that ultrasonic kind of cleaner thing that kind of zaps you.
I mean, you don't.
This has little needles in it, though.
Yeah, needles, and through the needles, apparently, radio frequency comes.
Okay.
And if I can,
Gosh, I wonder where they got that idea from.
Well, okay. So they're ripping me off,
Rip
Rob.
me off, man.
Can I say the difference that I saw, or no? Should I just keep my
Sure,
mouth
if
shut?
you want to.
Well, it felt like, gosh, how can
He's
I say
just
this without being
bragging.
gross? No, not at all. The 2 weeks after you did it, it felt sort of like you were ribbed for, where they used to have those condoms that say ribbed for your pleasure. That's what it felt like. You could tell that it was concentric rings sort of.
You think it's from the inflammation where they did the needles?
Well, yeah. I mean, it causes increased blood flow.
Yeah. Interesting.
So that was interesting. I did notice that. So good.
So there.
So would you recommend it? That's the question
Well,
that they're asking.
it's I'm glad I did it.
It doesn't listen. If you have a giant cystocele, which a
Yeah.
cystocele is where your bladder is actually dropped because the bottom part of the bladder is top part of the vagina, and if the vaginal wall has become so thin, the bladder can sometimes drop into the vagina. It's called a cystocele, and sometimes it can get so bad that you can actually see it from the outside. And I don't think this would solve that problem. But if you are relatively young, as Tacy is, and starting to notice that your control quite isn't the same, because women have a problem because there's just like an inch from the outside to the inside when it comes to the urethra, whereas guys, like me, it's at least 10, 12, inches from the outside to the inside. So, it's a lot harder for urine.
It was really starting to bother me, and now it's better.
So you're happy. Mm-hmm. All right. So it was worth it, and you did no surgery.
No surgery.
Okay, good.
Cool.
Who was it that was asking about that? Oh, don't say it, because then she'll be embarrassed. Because she was just asking for a friend.
Oh, Cindy.
Yeah. Okay. Yeah, and Cindy, if you do it, let us know.
Yeah. And she was wondering if we thought it might help with vaginal atrophy as well.
I'll have to look at the data on that. It does increase blood flow, and it increases stimulates some tissue growth.
We can say hypothetically,
but I don't. If you'll email me, I'll get you some data on that. I can find it. What really works for vaginal atrophy, though, is estrogen cream.
Yeah.
All right.
Yep.
Any other questions, comments?
Nope.
That's it.
Are we good? Everybody happy?
I'm happy.
Are you happy?
Wrap
I'm
it up.
happy and hot.
Yeah,
you are hot.
Wrap
Tace.
it up, and
you're gonna get you.
It is 90-something
You're gonna
degrees
get you
in this
some.
room.
That's what she said.
Mm-hmm.
That
It's
doesn't
'cause
even
of
make
you,
sense.
Steve.
That's right. Well, thanks always go to Dr. Scott, and thanks to Tacey. Thanks to everyone who's made this show happen over the years. It has and continues to be the most fun I've had in my 6 decades of existence. Outside of my marriage, obviously. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern. I think they just changed this, by the way. Just listen to it on demand. That's the best thing to do. If you have SiriusXM, you have an online subscription. Just go on demand. And other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website, drsteve.com. For schedules, podcasts, other crap, check out Dr. Scott's website at simplyherbals.net. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. And see, I cut out all the shout-outs, Tace, just
there
for you.
Go.
If you didn't hear your shout-out, you can thank Tacey for that.
Thank you. You're welcome.
All right. Let's do the opening. And then we'll play a song. We actually practiced some songs for you guys. I'll still suck, but Scott actually quite surprised me. All right, you ready?
Yep.
Here we go.
I was gonna tell you a sock joke, but it stinks. Try It Again by The Whispers on Amazon Music. I was gonna tell you a sock joke, but I got cold feet. How is a private eye? Like the dry cleaners? They both do other people's dirty work. Why did the baseball catcher spend a night at the field? Because he felt right at home.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Goldstein Network Studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott. The traditional Chinese medical practitioner gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Please don't forget to check out stuff.drsteve.com, stuff.drsteve.com for all your Amazon and online shopping needs. And tweakedaudio.com, offer code FLUID for the best earbuds for the price and the best customer service anywhere. Dr. Scott's website at simplyherbals.net and patreon.com/weirdmedicine. We've had the Troika on now. We had Jim Norton, Greg Hughes, and Anthony Cumia, and they were all fun and very different, and but loads of fun. It was really a lot of fun. Mm-hmm. And then we've had Mark Normand and Joey DeRosa, Bobby Kelly, and we've got more coming. So hang in there on that, and check if you want me to say fluid to your mama.
It'll cost you $5.
Yeah, well,
$5.
I don't know what it is right now. I keep changing it. I just mess with it all the time. It's very inexpensive, whatever it is. Go to cameo.com/weirdmedicine, and I'll basically say anything you want me to within reason. All right? And within reason for me is I've got a pretty broad range of things that I'll say. So.
The threshold's pretty low.
Yeah. It's fun, though. I have fun doing it.
That's cool.
All right. Get out of here, Tace.
Thanks, Tace. You're the best.
We're going to play you some music.
Everybody loves Tacey. I think they just listen to the show because they want to hear Tacey.
Yeah. They want her to... Yeah, you did. You talked about your cooch and everything. What are you talking about?
It's kind of an important subject.
Yeah. I'm glad Cindy asked about that. Talk about your vag.
It is hotter than hell up here.
Feels good. We're going to fix it. As soon as I make enough money to put in that air conditioning up here, we'll do it. I can't use family money for that.
No. You're getting trouble.
And I'm spending money to go to Rochester, and Nashville to perform for free.
When you go to Nashville?
I already went.
Oh, yeah, that was before, yeah.
Yeah. All right, you ready? What is that?
That's my brother. My other brother. Yeah, we ready? You gonna play some one?
No, yeah, almost.
Hey, brother, what's up? We're at
tell him don't worry about what we're doing.
Yeah, I'll call you. No, it's okay. I'll call you about 15 minutes. Okay, bye. They don't care about us. They just care about Tacey.
Was that Shlomo's dad?
No, that was my concierge.
Oh,
like my attorney, my other attorney.
Oh.
Not my in-house attorney, but my other attorney.
I don't know what in the fuck you're talking about. So
no, you don't. You don't need to know.
Cryptic.
You want to do an old school before? Love it was saying, "Play I Know You're Writer."
No, we've done that.
Helps if I'm in tune, doesn't it?
What the hell?
Oh no! What's the matter?
Oh!
Oh no! What's the matter? I hate when you're so vague.
No, I think I know why the power went out.
What happened?
I think it was the surge protector went out.
Okay.
Anyway. All right.
That's a problem. Sounds good.
Yeah, let's not use that.
Let's see here. Give me. Is that pick? The picks make it too loud?
No, it needs to be loud. Okay, what? Okay, which song were we going to play again?
Do you want to do
you want to do that medley?
Robert Earl Keen?
Yeah, we can do that.
Yeah, feeling good again.
Yep.
Make sure it's not too loud on here.
That's the one that goes G,
B minor, yeah. E minor. D. Sean, can you hear it? Hey, Kush is saying rocket, Dr. Steve. That's exactly right.
Where's the tab for this? What's it called? What's it called again?
It's a feeling good again. Feeling good again. I sent it to you via email.
I didn't get it.
Oh, shoot.
Yeah, I asked you to send me all those tabs. I never got any of them. That's weird.
That is weird. Yeah, because I did send.
I believe you, but I didn't get them.
Yeah, Colin Carnes. What's up, CC? He knows Robert Earl.
All right, you ready? You start it off.
Standing down on Main Street, across from Mr. Blues, head in leather jacket and my worn-out brogan shoes. Till the north wind was blowing, but the spring was coming on, and I wondered to myself just how long I'd been gone. So I strolled across old Main Street, walked down the flight of stairs, stepped into the hall and saw my friends were all in there. A neon sign was flashing, welcome, come on in. Feeling good again. My favorite band was playing an Otis Redding song. When they sang, of course, everybody sang along. Dan and Margarita were swaying side by side. Heard they were divorcing, but I guess they let it slide. And I wish I had some money to which to buy a round. I wish I cashed my paycheck before I came to town. But I reached into my pocket, found 3 20s and a 10. Feeling good again. There was old man playing and sitting on his stool, watching Butch and Jimmy John talking, playing loud and playing pool. My boys from Silver City were standing by the fire, singing like they thought they were the Tabernacle Choir. And I wanted them to see you. I wish that you were there. And I looked across the room and saw you standing on the stairs. And then I caught your eyes and saw you break into a grin. Feeling good again. And I want them to see you, and I wish that you were there. I looked across the room and saw you standing on the stairs. When I caught your eye, saw you break into a grin. Feels so good, feeling good again. Feeling good again. But it's tough to get those fingers moving like that. Holy cow! Oh my! Sorry guys, that was a great song. We tried not to butcher too bad. This is only my first week of playing banjo, so that was so much fun though.
Which I'm impressed by. I thought you've been practicing this whole time. To pick up that much in a week is not bad. So, what was the other song that we were gonna do? Oh, was it we were going to do it as a medley.
Oh, yeah.
It was Have You Ever Seen the Rain, right?
Yeah. So what we'll do, let's do this. Have you ever seen the rain? Let's do Have You Ever Seen the Rain? And who did we do that by? It's CCR. Yeah, CCR.
Who did we do that?
Yeah, pretty stupid. Metallica. So what we'll do is we'll go Fogarty. Let's go.
We should do Wild Horses.
Okay. Going to G.
You want to start with G?
Yeah.
Someone?
Yeah, someone.
G.
Yep. So we'll just roll. We're going to roll right out of that. Let's do the G, B minor, E minor. Then we'll pick up the C.
So the intro starts on E minor?
Yep. Someone told me long ago, there's a calm before the storm. I know it's been coming for some time. When it's over, so they say, it'll rain a sunny day. I know shouting down like water. I want to know, have you ever seen the rain? I want to know, have you ever seen the rain? Coming down a sunny day.
Slow it down.
Yesterday and days before, sun is cold and rain is hard. I know, been that way for all my time, till forever on it goes, through the circle fast and slow. I know, it's been falling for some time. I want to know, have you ever seen the rain? I want to know, have you ever seen the rain? Coming down a sunny day.
That's when you forgot to start over.
Let's go back to the. Let's see. Here we go. No, you know what? This stupid version.
For you to start singing again.
No, it's my fault. I hit the wrong fucking tab.
All we had to do was go back to that.
Go back. I know it. Oh, no. Have you ever seen the rain? Yeah, it's my fault. I just couldn't find the right damn. The tab I had, Steve, it was only half of it had the chords on it.
Okay.
So that's totally me. Yep.
Let's play Wild Horses on the banjo.
Yeah, let's do that. Wild Horses. Yeah, sorry I butchered the end of that. It's a beautiful song. Let's see here. Let's see. By the Rolling Stones, baby. All right, last one, guys, and I got to go. Got to go. Let's see, yeah. Wild Horses. All right. Wild Horses.
You ready?
Yep.
Here we go. 2, 3, go.
Childhood living, easy to do. The things that you want, I brought them to you. Graceless lady, slide through my hand. Wild horses couldn't drag me away. Wild horses couldn't drag me away. I watched you suffer, a dull and aching pain. Now you decided to show me the same. No sweeping exit or offstage line could make me feel better or treat you unkind. Wild horses couldn't drag me away. Wild horses couldn't drag me away. I know I dreamed of you. I don't make it lie. I have my freedom, but I don't have much time. Faith has been broken. Tears must be cried. Let's do some living after we die. Wild horses couldn't drag me away. Wild horses will ride them someday. Wild horses couldn't drive me away. Wild horses will ride them someday. There you go. That was not the worst. It was not
the
the
weirdest version ever, but okay.
I could, you know what? I take this is just such a weird instrument to play.
I know, but you do.
to just
Actually, just you're kind of figuring out your own thing. I kind of like it. Anyway,
It just took me a second to get to my fingers right. Because I'm telling you, that is a weird movement there. But it's fun though. It's a lot of fun.
Yeah, we'll do a real music stream. And what we'll do, because we used to do this, and we need to, we've played in public before.
Yes.
Way before COVID. Actually, before GVAC died. So it's been quite a while. And we practiced and got good. Well, good enough to play out in public, as long as I never wanted us to be on stage with people watching us and then polite applause.
Oh,
at the
no,
end.
a golf club.
I want to be in the background, just off in a corner, and it's sort of just white noise for people.
Yep.
But we should do that, and we'll set up a live stream outside, and we'll play tunes and drink and stuff.
Yeah, that'd be good.
Yeah.
Well, we appreciate
All right,
you
we'll
guys.
do that. That's a great idea.
And we will. I will continue to improve. I promise. I like the challenge.
No, you can't say we are not terrible anymore. No, we're still terrible.
No, we're not terrible. We're just not bad. We're not good. We're just not terrible. We're not good. We're not terrible. Hey, you guys have a good week. We'll see you next Wednesday.
All right. Hey, thanks, everybody. Oh, we might, Patreon listeners, we might see you for a live stream on Saturday. That's a distinct possibility.
Okay.
All right. Thanks, everybody.
Thanks, guys.
Bye.